Thank you, Mr. Chairman. I want to thank all the witnesses for being here today. I'd like to begin by saying that no one should be threatened, harassed, or assaulted because of who they are, who they worship, or what they stand for. We must do more to combat anti-Semitism in this country and ensure that all Americans are treated with the dignity and respect that they deserve. When it comes to health care, patients and providers must be able to rely on a safe environment free from discrimination. If that is what has motivated this hearing, I think we should be able to come together in a bipartisan manner and discuss solutions. But I fear that yet again, the majority is weaponizing the issue of anti-Semitism to attract groups they disfavor, like labor unions. Today marks the 11th time in the last 3 years we have held committee activity to address anti-Semitism. Committee Democrats want to meaningfully address hate and discrimination. However, after nearly a dozen hearings, it is abundantly clear that committee Republicans have no interest in addressing the issue in good faith or discussing an effective response. Instead, the majority has weaponized this issue for their political objectives rather than tackle anti-Jewish animus in a serious and enduring way. As I've said many times before, and other people on our side have said, we're willing to work with you on that issue. If my colleagues were serious, they would call out the leader of their own party, President Trump, who has made anti-Semitic statements himself and emboldened right-wing extremists to spew hate with not only impunity, but with celebration. At the same time, the majority will also hold hearings to address racism, xenophobia, sexism, Islamophobia, or similar harms that Americans face. On both counts, committee Republicans have been silent. Even more critically, this committee has stood on the sidelines while this administration has dismantled the lead civil rights agencies responsible for investigating discrimination and protecting patients, healthcare workers, and medical students. The silence is deafening and telling. Hate cannot be tolerated anywhere, including in unions. However, it is irresponsible and unproductive to take the words and actions of a few and broadly categorize labor unions as fostering discrimination. I want to remind my colleagues that the labor movement is a large, diverse coalition of workers, including Jewish Americans, many of whom have been very prominent in the American labor movement. It has been a significant force in the battle against anti-Semitism and other forms of hate throughout its history, not without its challenges, like America as a whole. At the end of the day, the fight against discrimination in healthcare is not separate from the fight for affordable care. When entire communities face barriers to quality care, costs rise, preventable conditions go untreated, and working families bear the burden. Our healthcare system should work for everyone, regardless of who they are or where they come from. Our committee has a real opportunity to improve access to healthcare, make care more affordable, and address inefficiencies in the healthcare system that cost both patients both their economic security and their lives. However, the Trump administration has taken the problems that patients and healthcare workers face and made them demonstrably worse. Since President Trump returned to office, his administration and congressional Republicans have waged relentless attacks on the health and well-being of the American people, particularly the most vulnerable Americans. Republicans have failed to meaningfully lower drug costs, and thanks to their big ugly bill and failure to extend the Affordable Care Act, enhanced premium tax cuts, millions of Americans have seen their health care premiums skyrocket. At the same time, President Trump's reckless economic policies and foreign wars have exacerbated a cost of living crisis in which 1/3 of Americans could not afford a $400 emergency expense. I think everyone here knows that a medical crisis costs a lot more than $400. The Trump administration policies in this Congress's inaction have also harmed our ability to address discrimination for both workers and patients. Multiple agencies, including the Department of Health and Human Services, has slashed programs and research they deemed to be too woke. and ban words such as Black, disability, trauma, accessible, and mental health. How are we supposed to stop discrimination if we aren't allowed to describe it? These policies have not made Americans, including Jewish Americans, healthier or safer. Instead, Americans are forced to scrap the bottom of the barrel and skip doctor's appointments to avoid crushing medical debt. The leading cause of bankruptcy in the United States is medical debt. We should be addressing that. Democrats are committed to protecting people from hate and discrimination and providing safe, affordable health care so that all Americans can access the care they need. I look forward to today's discussion and continue to look forward, Mr. Chairman, to work with you in a principled way on addressing discrimination in America.